Good morning, everyone. I'm Marilyn Emery, President and CEO of Women's College Hospital, and I'm really pleased to welcome all of you to our hospital this morning. Today we'll be hearing from Minister of Labour Kevin Flynn, Minister of Health and Long-Term Care Dr. Eric Hoskins, and Dr. Ruth Heisey, Chief of Family Medicine at Women's College Hospital. You know, it goes without saying that the health and well-being of people in Toronto and across Ontario is exceptionally important to all of us. As champions of health equity, we want to ensure that everyone has access to the health care that they need when they need it. I would now like to invite Minister of Labour Kevin Flynn to share this morning's announcement. Minister Flynn has been an MPP since 2003 and has made protecting vulnerable workers and building fair and safe workplaces his focus since becoming Minister of Labour. Minister Flynn.
Thank you. It is a pleasure to be here this morning. Thanks to each and every one of you that has taken some time out of your day to be with us for this announcement. Thank you, Marilyn, for those very kind words. It's amazing to be at this great facility. I have to admit that despite the fact I spend many of my working days in close proximity to this building, it's my first time actually through the doors, and it is everything everybody has said about it. But it really is a facility that I think really sets the example, sets that high bar that we want, because it does so much to keep Ontarians healthy, and it sets an example, I think, to what a healthy workplace really should look like and the way that it should behave. What we're seeing all across this province, whether you're in Toronto, Thunder Bay, or Ottawa, is that people are anxious about their jobs and they're anxious about their own futures. With all the rapid change we're seeing in the economy today and all the uncertainty that that can bring, it's tough some days to feel like you're getting ahead. And it's tough on all our families as well. People are worried about what their job might look like in the future. What's going to happen to their children as they become adults? What world of work will they be entering? And more jobs we can see on a daily basis are going contract, temporary, or part-time. Now, for the past couple of years, the plan of our government has been pretty straightforward. We've had a very firm focus on economic growth. We needed to eliminate the deficit. We needed to support new jobs. And we needed to invest where it made the most sense and where it has the most impact. We know that's in new hospitals, such as this. We know it's new schools and roads and bridges and highways. So we are making an awful lot of progress. When you look at the health of Ontario's economy today, unemployment is at its lowest point in 16 years. Our economy is growing faster than any other province, any other territory in the nation. We have a balanced budget. Ontario is outperforming most jurisdictions in the United States, and that's very, very encouraging. But we know it's not enough. Our workplaces are being tested in new ways. Technology and automation are putting existing jobs at risk. And while our businesses are expanding and creating wealth, not everyone is sharing in that prosperity. There's no denying that this is a time of change, and it's also a time of vulnerability for many people. It's at times like these that we as a government must protect people as best we can. Our response must be bold. We have a responsibility to step up and to take action, and we have a duty to protect the well-being of our people by being progressive and innovative and inventive. But we need to have a clear purpose, and that's what we've had with the Changing Workplaces Review. We need to ensure fairness and decency in the workplace. If we make the right choices now, we can help all hard-working Ontarians set our province on a course towards that long-term success. Just last Tuesday, Premier Kathleen Wynne and I announced very historic changes to the employment and to the labour laws in the province of Ontario, changes that will lift thousands of people and their families out of poverty. It's a very broad-ranging plan. It's a result of a 2-year comprehensive review of Ontario's Employment Standards Act and the Labour Relations Act. Changing Workplaces Review was done in the first place to help address today's challenges brought about by the modern nature and the changing workplaces when it comes to employment in the province of Ontario. The workplace environment, as we know, is changing at an unprecedented rate, and while our law-abiding business community is moving forward, we need to make sure that real opportunity for workers grows along with that. Sadly, the facts tell us some things we didn't really want to know. There's more vulnerable workers in the province. There's more people who are living in poverty. Nearly 1 in 5 workers are now part-timers, and those part-timers earn about half as much an hour as somebody that is working full-time. These were the facts that we needed to deal with. These were the facts that needed to be laid bare. We needed to find out exactly what it was that was keeping some workers and businesses from reaching their full potential. We had to determine what we as a government could do to ensure that everyone is able to share in that strong and prosperous economy and that everyone was living strong and healthy lives. The question was very simple yet fundamental. What do we want the modern workplace in Ontario to look like today? The answer is to have a lasting impact on the lives and the health of all Ontarians. So the plan we unveiled on May 30th will go a long way towards ensuring this modern workplace is one that is decent and one that is fair for everyone. As you will see in the plan, the effects of our plan will also create healthier workplaces and healthier families. A number of things that are included in the plan is obviously a $15 minimum wage to be phased in over the next 18 months. Equal wages for equal pay for part-time and temporary workers. What this means is that if 2 people are doing the same job, but one is part-time and one is full-time, they will be paid the same hourly rate. We're also, though, providing personal emergency leave. When we look across the country, there's one province that doesn't provide personal emergency leave to all its citizens, to all its employees, and currently that is the province of Ontario. We knew we needed to change that. We knew we needed to start including paid sick days for all workers. This includes leave for workers who have tragically been the victims of either domestic or sexual violence. We're prohibiting employers from requesting a sick note from an employee who takes that personal emergency leave. We're increasing vacation days in the province of Ontario. We looked at other jurisdictions around the world, and we didn't look like we fared too well. We looked at it looked like other jurisdictions had a better handle on that work-life balance that we all strive to achieve. We needed to make scheduling more fair, and we needed to boost family medical leave. So these are just a few of the changes that were contained in the almost 180 recommendations that came from the Changing Workplaces Review. The response from the government has been quick, it's been rapid, it's been introduced to the House. It will be traveling the province of Ontario this summer. And the idea is that we're going to bring balance back to what has become a very unbalanced system. It's going to make our workplaces healthier. Now, in a few minutes, my colleague, Minister Hoskins, will delve a little deeper into the health benefits of our plan, but I wanted to highlight a few key points that came to mind when we were putting the Fair Workplaces, Better Jobs Act together. What we are doing is ensuring that fewer Ontarians will be forced to work 2 or 3 jobs just to provide the basic necessities of life. That's food, that's rent, that's children's clothing, all the basics. With more money in their pockets and more time to spend with their family, workers across this province will have a little less stress in their lives. Paying their basic bills will be easier. Planning for the future of their own children will be easier. It's a path forward that we want to ensure protects workers and keeps them healthier. Ontarians are hard-working people. They work very hard to build a province where working people and their families have an opportunity to truly prosper. That's what Ontario is all about. People have traveled from all over the world to live in Ontario. We all come from somewhere. We don't have to go too far back to find somebody that decided they were going to pick Canada, they were going to pick Ontario. And we've chosen to live here because it's an amazing province, and we're confident in the opportunity it provides, for the hope it gives us, for the reassurance we have knowing we can achieve those goals by simply working hard. A better Ontario is within our grasp, and a healthier future is within our grasp. It's up to us now to take the challenges provided by the Changing Workplaces Review and turn them into legislation that's going to benefit all Ontarians. Somebody that I work with very, very closely, we sit next to each other in Cabinet, and we have the opportunity to talk about things in our portfolios and how they often how they are often linked, and that is the Minister of Health, Eric Hoskins. Eric is a tremendous colleague. I know he's well known in this building, and certainly when we were talking about sick time, sick notes, we were talking about the impact that it has currently and the impact it may have in a positive sense if we could do it better. Eric didn't give me a moment's rest on that issue, so I'm so glad we were able to include it in the response to the Changing Workplaces review. So would you please give a warm welcome to my colleague, the Minister of Health, Eric Hoskins.
Well, thanks, Kevin, and good morning, everyone. It's wonderful to be back here again in Women's College Hospital. It feels like it's becoming a second home for me. I've had a number of announcements in here, but I'm so proud and, quite frankly, impressed with the incredible work that is done by this hospital and by the hardworking frontline healthcare workers that are working day and night for the benefit of Ontarians. So thank you all for being here today. I'm going to focus, as Kevin alluded to, on one tiny but critically important part of the proposed Fair Workplaces and Better Jobs Act, and that's sick notes. And Kevin's right that it was an advantage for me to be sitting right next to him at the cabinet table. So every Wednesday, I had the opportunity to remind him as the Act worked its way through cabinet discussions. But I have to say that Kevin has always been a strong proponent of fairness in the workplace. I believe it's remarkable, the package of changes and improvements that he's put together and his ministry has that will make it a more fair province, but also from a health perspective, really hits a home run in that area of the social determinants of health. And I think probably most of the people who are here, including the media, would agree that likely the most important thing we can do to keep and get Ontarians healthy is to address those issues of equity and fairness and the social determinants of health. So, for example, the minimum wage increase speaks directly to that issue. So I'm hoping everyone here is feeling well and feeling good and healthy. If not, you should probably be at home right now. And that's one thing this legislation is going to help with. Making sure people can stay home and get the rest they need when they're sick and they're not sitting in their doctor's waiting room instead. What this means for the vast majority of employees in this province, sick notes are, with this proposed legislation, will be banned, and employers are prohibited from asking workers for sick notes. So the only asterisk to that will be after the personal emergency leave, those 10 days per year, which apply to both full-time and part-time employees, regardless of the size of the business. After you've used up those 10 personal emergency leave days, that's where the ability for an employer to request a sick note kicks in again. But for those 10 days, which again, for the vast majority of Ontarians, they will not reach that 10 threshold in a year, and it renews each year. Sick notes will not be required of them and cannot be requested of them. And I do want to thank Minister Flynn for his leadership on this bold workplace transformation that's going to make life easier for workers across Ontario. And I want to be clear about this. All working Ontarians will now be entitled to 10 sick days each year, and that's personal emergency leave days. We're also proposing to expand the definition of that. So it may be that you're sick, or you may have a child that's sick, or a parent that's sick, or there may be an injury or an emergency that you need to attend to for certain family members, and all of that comes under the personal emergency leave. And as Kevin has referenced as well, a minimum of those 10 days, a minimum of 2 out of those 10 days also must be paid. And that's a threshold, that's a minimum threshold, those 10 days and the 2 days paid that this bill proposes. But certainly there already are, and I hope there will be more, businesses that choose to go above that minimum threshold. So with regards to sick notes, sick Ontarians will be able to focus more on getting well instead of worrying about getting to their doctor or their nurse's office for a note to explain their absence. And I know that this is something that Ontario doctors have asked for in the past. In fact, in 2014, the OMA issued a statement themselves where they called for banning sick notes. In fact, as many public health experts have also called for. And there are a number of key benefits to this initiative. When you have a bad cold, for example, you know that there's really practically, there's not much that your primary care provider can do to help you. What you need is rest and hydration and perhaps some over-the-counter cold medications from your local pharmacy. If you, however, need to bring a doctor's note to work to call in or after you've called in sick, you're likely to do one of two things. You might simply tough it out. Those are the people, you know, that do show up at work, and everybody sort of goes the other direction. Nobody wants you doing that, not you, and certainly not the person working beside you. Or the other thing, if you don't tough it out, you go to see your doctor or nurse, even though you both know, and you're sitting, and I've done this any doctors or nurse practitioners here know this. I've done this thousands of times, where you're sitting there looking at each other. It may be that the person's already feeling well, and so you're just going on trust that they were sick in the first place. But you also know there's really practically nothing that you can do for the majority of people that come in requesting a sick note. It's just a process, and it's a process that often costs the individual, the patient, money, maybe in gas or transit, and often they will have to pay a fee to see the doctor because it's not an OHIP insured service to get that sick note. So from a patient perspective, this becomes one less thing to worry about when you're not feeling well. But we also know that this is going to help out our family doctors and nurses as well, because we have been working hard to guarantee that every person in Ontario is able to get access to their primary care provider on the same day or the next day if they require that, if it's an urgent matter. But when their schedules are booked with people with bad colds and needing sick notes, they're not able to see all their patients that need them in that timely manner. So this legislation will help to free up our primary care providers to see the patients that genuinely need their care, and not those patients who are only in their office because they need a sick note for their boss. And of course, those same patients sitting in the waiting room or reception area probably spreading their germs to other vulnerable patients at the same time. And that's the public health argument, where virtually every medical officer of health in this province will tell you about the problem with sick notes, is that it takes people who are ill and often infectious or contagious themselves, and it brings them into an environment of vulnerable people who are in a waiting room waiting to see their doctor, and it spreads those germs. So it actually, from a public health perspective, especially during those seasons where we're seeing flu, in the winter time, those are the times where we should actually keep those people as far away from clusters of people like what we see in waiting rooms. So this new policy makes sense for workers, but it will also improve our healthcare system as a whole. Now, I can't resist the temptation in the last sort of 60 seconds to mention another important benefit to this initiative, and that is to remind people the importance, if you are sick, don't tough it out. Go home and get better. One of the simplest ways we can prevent the transmission of viruses is to stay home when we're sick. And this is the best public health advice that's out there. It used to be, just force yourself to get up in the morning and go to work. If you're sick, particularly if it's something that's contagious, go home, get well, rehydrate yourself, get rest, so you're not going to make your fellow workers sick as well. You can often see the spread of flu and colds through an office environment when people don't do that. And that helps to protect all of us, particularly those at higher risk of catching a virus, such as the elderly, young children, pregnant women, or people with pre-existing health conditions. So by no longer requiring sick notes, we're telling people that it's okay to stay home and get better. And it eliminates the need for an unnecessary trip to the doctor, exposing countless people to the virus along the way. And I think, and I'd hazard a guess that the doctors or nurse practitioners that are here today as well, I can't remember a single time when I have denied a person a sick note, because there's no way that a doctor can actually determine if a person comes in and says they were sick last Thursday and Friday and now it's Monday and but they're feeling better, but they have to get a sick note. There's no way that we can really have an opinion other than, well, we have to trust that patient of what they said. And so there's little, if any, validity or value to a piece of paper coming from a doctor with regards to a sick note. So there are so many good reasons, let alone public health and access to family doctors, for why this is the right thing to do. And as I mentioned, we have medical officers of health across the province, the OMA themselves, that have been calling for this for some time. So I'm very proud because Kevin has put it together with this very bold package of workplace and employer changes. I'm very proud to be standing here speaking about it with Kevin. Thank you very much.
Thank you, Minister Hoskins. I'm going to be echoing a lot of what you have already said and you've already heard here today, but as Chief of Family Medicine here at Women's College Hospital and a physician with an active practice, I believe people should be encouraged to stay home when they're unwell with conditions such as the common cold or flu. Pretty much every day in my practice, I see someone that comes to me simply for the reason that their employer has requested a sick note. These are sick people who know the cure for their illness is rest. They know that prescriptions are of no value, and frankly, I'm of no value to them at that point in time. Yet prior to this change in employment policy, they were required to come into the office to see me for a note, which essentially accomplished the following. It took an appointment time away from someone else who needed to be seen. It allowed the ready spread of germs in the waiting room. And most importantly, it did not allow the patient the opportunity to stay in bed and rest, push fluids, and take the much-needed time to recover. So I truly believe this change in policy, allowing people to rest rather than getting a sick note when they take an unpaid workday, makes good common sense and will help my patients and those across the province get the rest they need to recover faster, reduce the spread of diseases in the waiting rooms, and make more room in physician schedules for those who need to be seen. So I commend Minister Hoskins and Flynn. This is a wonderful initiative, and it's another step forwards towards our collective goal of reducing wait times to see family doctors across Ontario.
Thank you, Minister Flynn, Minister Hoskins, and Dr. Heisey. So this concludes today's announcement, and I'd now like to invite our three speakers back up to the podium to take any questions.
Where are some of the students, guys? Where are some of the students?
Answering this. Does this new legislation override collective agreements? And what I'm asking is, most collective agreements, if you're off for 2 days, and then you take a third sick day, you have to get doctors. You don't need them for the first 1 or 2 days. So does it and that's written basically in a collective agreement, does it supersede that? If you're off for 5 days in a row, do you not need a sick note when this legislation comes into effect?
Probably I'm best to answer that. I think, no, what this does, it really establishes a floor. It establishes a base. Anywhere a collective agreement exceeds the minimum requirements, then it's fine for that collective agreement to go.
Agreements don't reach the plateau of 10 days, usually.
No, I don't think you can collectively agree yourself beyond the bounds of the law. So in this case, the law of the land would be that you cannot compel somebody to bring a sick note in. A collective agreement cannot compel you to do that. But there is a place for medical assessments. So for example, for short-term disability, for long-term disability, for somewhere where there's a chronic condition, there may be insurance companies involved, that type of thing. We understand the need for medical assessments, but when it comes to absences, under personal emergency leave, under the provisions that exist today, and the expanded provisions I hope that will exist after the legislation is passed, no, the law of the land will apply in that case.
Minister, has there been any pushback from employers on not requiring sick notes, or what's your feeling on
No, to date there hasn't. To date there hasn't. Rob, I think where the penny really dropped for me was I was invited to sit at a round table, and it was with the CME. It just happened to be with the CME, the Canadian Manufacturers and Exporters. And as I was getting ready for the discussion we were going to have, I looked around the table at all the companies that were represented. I thought, you know, all I want to come out of this review is for everybody to treat their employees the way that all the companies around this table do. So a lot of the Changing Workplaces review is already standard practice for other companies. It's going to be a blip on the radar for an awful lot of companies, but it's for those companies that currently fall under the new minimums. We're asking them to step up their game.
If, in our collective agreement, it has that if they require a doctor's note, they pay for it up to $25. But in this instance, if it's 2 days and your collective agreement and it says that they will pay for it, does it still supersede the collective agreement that even though they ask for it and they're going to pay for it, you don't bring it in?
Yeah, it can't. You can't collectively bargain your way out of the law. The law of the land will always be supreme over any collective agreement. But a collective agreement, as I said earlier, can go beyond that, and that's what we wanted to do. We're establishing the floor. Most Ontario businesses are far beyond this already.
Anybody else?
Great. Thanks, everybody.
Great.
Thank you.